call the workshop to order. I'm going to say a couple of quick words, and I'm going to turn it over to Deputy County Manager Kathy Hedin to tee this up. But this is a continuation of ongoing work in the evaluation of the work that we did with our CARES money. But it's more than that. It really is to ensure that, you know, we were getting benchmarks and reaching our goals that we had set out when we pulled together, whether it's, you know, the food and basic needs, whether it was homelessness, whether it was child care, so many areas that we were investing in, workforce. We've seen, you know, we already had that presentation. But I've talked to Ryan, and I know we've had the conversation. It also is a tool for us to use in the future, because these were partnerships that we pulled together. There are times when we were delivering the services and we were responsible. There were times when we were the partnering with the community, and there were times when we were the convener and bringing community together to respond to a crisis in our community. And it's really a good learning tool. That's why I'm so grateful that Ryan and the team had the foresight to bring in the evaluation team right away to really help us, again, not only, you know, give us a good sense, did we reach our goals with the money that we invested in the community, but how do we do better moving forward and being responsive to any type of crisis that comes to us. So thanks to everybody that's had the foresight, and thanks for our evaluation team and being a part of that process throughout the CARES money and into the future. And with that, I'm turning it over to Deputy County Manager Kathy Hedin.
All right. Thank you, Chair McDonough. I appreciate the introduction, and I'll keep my remarks short because we have a lot of slides to get through for this workshop. Today we have food and basic needs, as was discussed with Carissa Glatt, who's our food security coordinator, and Azra Thacker, our senior program evaluator. And then we'll move over to our research, racial equity, community engagement response team, work and evaluation with Sarah Hawley, and then Sarah Maya, our senior program evaluator. And I'll just give you a few key takeaways. If we want to move over to the PowerPoint to the control room, that'd be great. Thank you. So, you know, the food and basic needs work over this past year has engaged community who really helped us build the framework for virtual community engagement throughout this response across our system to COVID. We've also learned that there are benefits to a community engaged process where community guides our program efforts and defines our goals. And we know we must work together internally across our programs, including contract managers, including evaluations and others, evaluation and others to be successful. And I do want to note that this work actually isn't coming out of a department. It's actually coming from our incident management team, and it moved from that work during our within this emergency and out into multiple departments with multiple leaders working together with community to make this work continue and to help to sustain it. So I think it's important to mention that, and it continues to be a work that is led out of multiple areas. So with that, I will turn it over to Carissa Glatt.
Welcome.
Thank you. So I just want to take us back to March of 2020. We all remember that. It was declared emergency response. And at that point, food and basic needs became an immediate priority for the county. And so then the IMT was created, and so food and basic needs became a clear need. Our own Sarah Hawley hosted 3 community events that had over 100 participants at most of them, and as well as some surveys, organizational surveys and community surveys that I believe there was over 400 respondents for that, of what kind of priorities should the county have around food and basic needs. In the meantime, our planning team also started to look at data, the impact of COVID, what kind of assess the situation with food, and there was a needs assessment completed, and with the alignment of those two things, there was obviously a clear need for trusted community messengers, which you've heard a lot about within our research work. And CARES dedicated $10 million for the food and basic needs. We also, under Commissioner Ortega, had the PAG subcommittee to do some discussions and guiding of our work, as well as ongoing community engagement. Just a quick overview of what we did last year. We had, with our 10 million, over 2 million went to school and youth to support existing structures that were feeding our youth and children. Also, over 6 million went to grocery delivery as well as home delivered meals. This was exceptionally important because we didn't want to reinvent the wheel. We wanted to push up our existing structures and food system and making sure that they could be pivot to meet people's needs, to keep people home, make sure that they were receiving culturally appropriate foods, make sure people had what they need to get through the hardships they were dealing with. And then also there was a clear need for broad communications, so we took some of our CARES funding within the food and basic needs to do multi-layered marketing campaign with social media. You'll see some billboards. I think there's still one in the north end up right now, as well as making sure SNAP and WIC were pushed out in the community and having access points, as well as making sure with our trusted community messengers, they had all the access to food access points in the community. And I'll talk a little bit more about that in a moment. Other priorities that came up within our 10 priorities were to support farmers markets, which we did put some funding in to make sure they were COVID safe. We provided food vouchers for those experiencing homelessness. And then also within the SHIP grant, we helped expand urban agriculture to make sure there was a longer term food system support. And then a few things that, just to highlight, one of our big efforts was that communications. And so immediately we created a food access or food resource website. So you'll see on the left of your screen, it's like a GIS map, and they put all the food access points, any pop-up food distribution, food shelves, other places that you could pick up food on this. And we tried to keep it up to date in real time. So that organizations, community members, and even our trusted community messengers could access where to find free meals and such, as well as making sure that our home delivered meals were broadly advertised as well. And then also at the same time, working within the open data portal to make sure that we could show community and organizations and even staff where our deliveries were happening, and to also make sure that we could see that we were trying to make sure that the people receiving meals were also the ones that were disproportionately affected by COVID. So we did a lot of things to keep this ongoing communications and keeping everyone on the same page to make sure everyone knew what we were doing within our food response work. And overall, just one thing that I learned within the IMT is that it's all about developing partnerships within the county with our colleagues, evaluation, making sure people were talking and understanding so that we could stay up to date within our teams, our community partners, and then also I think the IMT was really nice to be able to communicate everything we're doing every week, well, several times a week, just to make sure that, working within workforce, working within housing and homelessness, we could talk about resources for food too. And I'll turn it over to Ezra. Thank you.
Welcome.
Thank you. So like Carissa mentioned, this project really provided an opportunity for us to work really closely with one another as evaluators with the program side, and then also connecting, and not only with the program side, but also really with our contract managers. We all met regularly to review the data that was coming in addition to also sharing the information that we had with community groups. So the sessions that Sarah hosted with a lot of our food organization partners that were doing work in the community, we would meet with them regularly to also provide them with updates, share data as it was available to them, and then also making sure that that data was available on the open data portal. And so in that way, this project was a really unique way for us as evaluators to work really closely internally with community, and then also making sure that information was available to the public as well, in a way that was newer to me. I am newer to the county as well, so this project was a really wonderful way for us to kind of do this work in a truly community community-oriented way in which that we were able to do this. So when it comes to looking at the evaluation questions, these evaluation questions are very similar to evaluation questions that you may have seen presented before. So did Ramsey County address the community needs assessment priority areas? Did the CARES funding expand and enhance the free food supply and distribution network? Are Ramsey County residents better off as a result of food access expansion? And are Ramsey County residents getting connected to social services? The evaluation methods that we looked at included collecting monthly vendor reports where we had vendors share information about the number of meals provided or food that was available for the food shelf program. And then also we had them collect as much as they could zip code and race data, which we will admit is, a little bit all over the place. For some of the organizations, this was their first time potentially providing this kind of data, and so it wasn't always as complete as we would like it to be, but we did work and engage with many organizations to make sure that we had that data as much as could be available. Another evaluation method that we used was we administered satisfaction surveys to residents who received the home-based meals, and we received 639 back, which was about a 13% response rate. We conducted 4 vendor and staff focus groups in January to get a sense of how well was the process of contracting with us, and then also in providing services to residents to get a sense for what that looked like. One of the things that I forgot to mention for the monthly vendor reports that we collected, we did not collect individual level data from vendors. So anything that we collected was aggregated just to make sure that residents felt comfortable accessing services, and not everyone wanted to provide that information, and also to make it easier for organizations that were collecting this data to make sure that they were able to get services out to as many residents that needed it. But we did take a look at SNAP and WIC enrollment numbers just to get a sense of how much did things change in 2020 compared when the start of the pandemic happened to 2019. And we'll be sharing some of that data here today. So when it comes to our first evaluation question, did Ramsey County address the community needs assessment priority areas? These are the 10 priority areas that we had identified in response to the work that we had done with community at the start of the pandemic. And we met all of the needs that had been identified in that community needs assessment. I'm not going to read through them here, but they are listed here, and you can see that we were able to meet them. So this is one of the pieces of data that we did collect. So this is the home delivered meals by provider by month. And you can see, between August and December when the service was available to residents, the number increased steadily. And one of the things to note is that we were able to provide culturally specific food to residents using this service, and also to residents that were homebound, which was a big concern, throughout the pandemic. Our second evaluation question, we were able to meet as well. So the CARES funding expanded and enhanced the free food supply and distribution network. We contracted with over 35 organizations between August and December of 2020, and the organizations that we contracted with, it really allowed them to expand their services and allowed new organizations to enter the food and supply distribution work. There was a number of organizations that had not worked with the county prior to the start of the pandemic, and the funding that they received allowed them to kind of learn that process and work with us. As I mentioned earlier, people with disabilities and seniors benefited very greatly from the delivery services. And we were also able to increase the supply of culturally and ethnically specific foods and fresh produce. And so this isn't just, so I mentioned previously, through the home delivery service, we were able to do that, but we were also able to do that through some of the grocery delivery services that we were also able to provide. There was one vendor in particular that was able to make sure to provide a lot of fresh produce that was culturally specific to the community group that they were serving. So these are some vendor voices that come from some of the focus groups that we had. Overall, the vendors really enjoyed working with us. The partnership helped them meet their goals, and it helped facilitate some partnerships that they may not have had previously. So this first vendor mentions that they hadn't worked with St. Paul Public Housing before, but as a result of some of the funding they received, they were able to work with them to make sure that residents were aware of the service that was available to them. And then just the second quote that I will read, I think that this was just generally a huge success for us, is to be able to execute this project for so many more people than we would have been able to otherwise, and to get such nice feedback that it really felt like a treat for them and not just a relief effort. And this was, again, a very common theme for many of the vendors that we heard from. Another one of our evaluation questions, we were able to find that residents are better off due to food access expansion. For the home delivered meal service, we were able to reach around 8,000 residents. Through looking at the satisfaction surveys that we collected, many of those residents were very satisfied, and over 3 out of 4 residents that responded to the survey were from culturally and ethnically diverse communities. When it comes to the second service of the food program, so this was the grocery delivery service, or not grocery delivery, it was food shelf, I think, right, technically, Carissa? So over 22,000 deliveries were made from food shelves, again, where over half of those individuals served were from ethnically and culturally diverse communities. And then in the third food and basic needs service that we provided, this was the school-based meal service. Over 46,000 meals were distributed by schools, where almost 4 out of 5 of those youth were ethnically and culturally diverse, came from culturally and ethnically diverse communities. So here we have an example of one of the data pieces that we had available on the open data portal. So this is a COVID-19 social vulnerability and home delivered meals kind of overlap. And so this social vulnerability index is an index that the CDC has that shows areas that are more socially vulnerable to things like pandemics or other natural disasters or catastrophes. And this was put in place far before the pandemic. And so here you can see we did take a look at where home delivered meals were provided. And so we served over 23 zip codes, and the zip codes with the highest number of deliveries overlap with where communities are more vulnerable. So those are the darker shades here of the map. So another one of our questions was, are Ramsey County residents getting connected to social services? And as we mentioned earlier, we didn't collect identifying information just to make sure that projects could serve those who may have been reluctant to share personal information. And so we weren't able to match data from individuals who use services to our county administrative databases. And so this is a slight limitation, but something that we really needed to do to ensure that we were able to reach as wide a number of residents as possible. However, when we did ask home delivered meal participants if they received information about other food and community resources, we really worked very closely with our vendors to make sure that they had resources available to them, like a handout. I think it was a handout, right, that we provided that listed a number of resources that they could access. I meant almost 3 out of 4 said that they received that information. However, a very small number of participants actually reached out and contacted those services. Only 29% said that they had reached out and did that. And so that's something that is a little bit unclear as to why respondents may not have contacted additional resources, and something for us to be aware of as we move forwards. So I mentioned earlier we weren't able to connect individuals who received services to our social administrative databases, but we did take a look at overall enrollment in the SNAP program in 2019 and 2020, and WIC enrollment between 2019 and 2020. And you can see in 2020, the number of residents that were enrolled in the program has significantly increased over the number of residents that were enrolled in 2019. When we look at SNAP enrollment, you can really see, a variation in the number of residents that are enrolling between March and the end of the year. And when we look at WIC enrollment, it was elevated across the entire year of last year compared to 2019. And there is a small mistake here, but the blue line represents 2019. So when it comes to recommendations, in the short term, our recommendation was to continue to provide home-delivered meal program through the emergency and explore ways to support entire families. And this exploring ways to support entire families is actually something that, is true across all three of the food service programs that we started. This was something that we heard from vendors. Our eligibility to enroll in these programs was individually based. So when it came time to thinking about who would actually be able to receive those services, our eligibility is still very much individually focused, whereas we know that the pandemic actually impacted entire families, right? So if one person in the family isn't able to go out for food, what does that mean if they're living with others in that same household? Or for the school food program, we provided food to eligible students, but students also make up, they're living at home with other family members as well. And so what does that mean? And what would it mean for us to provide services or programs that served, where eligibility looked at an entire household and not just an individual, would be something to explore. Another recommendation that we had in the short term, and this also is true longer term, was that we heard from vendors that they would like more information on the proposal solicitation process, particularly for organizations that may not have contracted with us before. There's a lot of paperwork that's involved, how to prepare a budget and put something together in a format that we're used to looking at. And also just how to draft the language, right? And in terms of also explaining what it exactly is that they will be providing. And so that was something that, some vendors recommended, facilitating informational sessions that could be done over Zoom or online, or posting informational information on our website. That goes into the details of, what are all the parts and how to, draft some of the material that would be required for it. In the long term, we know that food access and food insecurity is going to continue. The pandemic is not over by any means, and people are still going to need to get connected to food and basic needs resources. We would recommend continuing our outreach with trusted messengers and vendors. And then one of the other things that we heard from community organizations that we contracted with was that it would have been helpful for them to for us to potentially facilitate convenings where organizations could hear about some of the best practice work that they were doing with one another. Because, there was some problem solving that some organizations did related to making sure they were working with local food distributors. That would have been really helpful for other organizations that were trying to do similar work, but were struggling to figure out, okay, who's the local food distributor that we should be working with, particularly at the start of the pandemic when, access to food and basic needs items, things were just kind of flying off the shelves, right? And so I think that's an opportunity where the county could consider, how do we bring some of these organizations together to actually learn from one another and, hear about some of the best practices or some of the things that they were troubleshooting in providing their services. And then, lastly, in the long term, it would be to continue to offer open-ended requests for information and to really continue to be flexible in how to meet the intended goals to help build capacity and improve on existing strengths. So this was something, vendors mentioned they really enjoyed the flexibility that they had in preparing the proposals that they put together for us, for the CARES funding. And so this was something that they recommended that we continue to offer to them.
Thank you. Sarah, I'm going to pause for this part before we move to the next. If there's questions, I know I have two. Mary Jo, go ahead.
Thank you, Mr. Chair. I was going to follow you because I'm guessing you might ask a similar question to me, but I'll just start and then you can
Sure.
you can wrap it up because you do such a good job, Mr. Chair, of always reminding us of what our policy director Elizabeth Holzman had at a workshop we had about what is the role of the county in these efforts. Are we a convener? Are we an implementer? Are we all of these things? And I'm seeing that part of this is about being convening, just bringing people together, bringing these community organizations together. We saw it in the child care policy action group as well. People just like to be brought together, and so if you would just comment on that role that we're playing in that, and I'm seeing it in so many things that we're doing. So
I'm going to turn that over to Carissa.
Yeah. Thank you, Chair, Commissioners. What we learned, we had ongoing community engagement meetings throughout the pandemic, well, still going, from last year and into this year. And that one thing I'll talk about in a little bit is the future. And it is what community has said is that we should be a neutral convener because we know there's competition out there for resources. We know food shelves and lots of different organizations in healthcare are competing against each other in some ways. And so I'll talk a little bit about it in the future, but it is something overwhelmingly that we heard.
And if I could add one
Go
more
ahead.
point. Thank you, Mr. Chair, because I think we're all seeing it too in our cities, and maybe you're seeing it in your community districts or your community councils. But in our cities, our cities say, well, who's bringing us together to make sure we're not duplicating, we're not working over each other, that we're working with each other. And so with our school districts, our cities, and all of that. So I'm glad to hear that because that is a great role that I think we can play.
Good. So if we could go maybe to slide 15. And the question I have, because you pointed out that we weren't able to connect those individuals with our data. And I'm wondering, is that a gap that is really important that we need to take a look at into the future that we can integrate and connect when we have these responses? Or is it not? I don't know. It seems to me it would be, but I want to hear from you guys.
Thank you, Chair McDonough and Commissioners. So in the beginning, we were really hesitant to start to get personal data when we were wanting to do home-delivered meals especially, because we know when people start giving data that they may not feel comfortable coming to ask for help. Also with undocumented communities and other communities that might not trust the government so much. If we started collecting data on who's receiving home-delivered meals, we try to keep it very separate. We were also in a different political structure with the past president. And so we were a little afraid that if we were serving undocumented individuals, that CARES, we had long discussions about it, that CARES might not reimburse us for our services. So we really wanted to keep it separate. We did do some, targeted mailings to people that had, I believe out of FAS, we got some addresses that we sent postcards about the food resources, but in general, we were trying to keep the private data separate. Especially for the home-delivered meals, we did ask for eligibility, but we didn't want to know if they had COVID, why they were homebound, things like that, because that starts to collect personal and identified information.
Thank you for that. I wasn't when I seen this, I wasn't hearing that it was really intentional that we kept it separate. I was hearing that maybe our system wasn't working where we wanted to do it and we could. So that really helps understand that there was intentionality about that and the right reasons. If you could go to slide 10 real quick. And this is, and again, I'm not quite sure, but I am surprised at this slide that by August we still weren't reaching very many people to help support them with food service, right? I mean, March is when everybody had a shelter in place. And those early months were really the most difficult for people, right? Because that was when nobody was going out, or very few people, even though there was still some things out there. And it took us to August to really even start having a little blip, but really till December to really start having the impact. And maybe just talk about that as a part of preparing for the future. were there things going on that, I'm sure there were, that we weren't, that was helping support the community, but how can we be much more responsive, much sooner, and have that flexibility to be able to do that?
Thank you, Chair McDonough and Commissioners. It was a lesson learned for sure, is with our procurement process, our EQ process. It took some time for us to get these contracts. We also only had a few applicants with our home delivered meals in the beginning, and so we had to do several versions of getting word out that we were looking for very culturally appropriate service providers to almost pivot what they were doing to try to make up for that. I can't say, by the time the end of the year rolled around, we had a lot more contracts with providers, and they themselves were responsible to do the recruitment and advertising and getting the word out. But overall, I think part of it was, just our own internal processes of being a little slower than we should have been.
Thank you for that. Ryan?
Thank you, Mr. Chair. And I think there's two parts, and Kathy and I are silently communicating on one of them.
I'll get out of your way.
No, it's good. Slide over. The schools had an infrastructure set up to take on some of the initial work. And what we learned through the schools is where the gaps existed. And then you can see as the summer hit where we had to ramp up as they struggled more and more. And so there's a little bit of that. I think the bigger thing, though, actually, and what evaluation can tell us, is this lays bare a bigger question. The county was not set up as a food and basic needs infrastructure provider. And I think part of the answer, it's good to look at our own internal spots and where we can get better. I don't question that at all. But the other part of it is we were not a food and basic needs provider, and all of a sudden everyone came to us and said, we can't do it for a variety of reasons. Please do it. And we had to fumble through and build it, and a credit to you and Commissioner Ortega with the PEG, the Policy Advisory Group Subcommittee, for helping lead that, and the patients, and Sarah for your work with research. But I think long-term, there remain this question now of, as a broader community, on a national and state level, we were okay with 1 in 4 kids being impoverished and not having enough food to eat. And this is what happens when a pandemic shows up. I still am not sure that the county infrastructure is built to be the long-term provider. But I also think it's important to say, if we're not doing that, then what are we doing to go beyond what's there? Because we're lying to ourselves if it's now set up differently.
And Kathy, I'll put just a quick response to that. And I think that really begs the question that maybe we aren't the deliverer of that service, but, to the point of, are we the convener, right? Because of our role in the community, we have 19 cities in a township, 4 school districts. Is that the convening role that traditionally we haven't seen ourselves in? But one of the learning things from this crisis is sometimes where those gaps aren't necessarily delivering the service, but actually convening the people together to actually provide and meet the needs of the community. So I see shaking the heads there and here, and Kathy, I'll call on you so you can add to it.
Thank you, Chair McDonough. You're right on, and you're going exactly where we're going and what we've set up already in place, and what we'll ask of you as we come to you at the budget in September. And so Carissa will get into that after we go through research and then get on to the next steps. But you're right on to where we're at right now.
Anything else for this? Yep. Commissioner Carter?
So I really did want to just say thank you to all of you for the work that's been done, and also for the obvious work that was done in making sure we were able to have an evaluation that would call out not only what the outputs were, which were tremendous, and certainly to look toward the future as to what the outputs need to be, but also whether anybody was better off, whether in fact we were connecting people in our community and doing a good job here, laying a foundation, working together with the community as to what the needs were out there, what the best methods of meeting those needs might be, selecting organizations who were deep in community and able to reach those that we could not. But again, as a convener, to be able to be on the ground through our partners and understand this, I think really did attribute to our doing in this emergency the best job we could to lean in, but also to examine what we do moving forward. So I look forward to the work that we will do to deepen those relationships albeit we pray not to be in this constant state of emergency, to be prepared, because undoubtedly we will again have the intense sort of need, and we will have learned much from this so that we can pick up faster and get the work done on the ground. So thanks again for the outputs and also for the orientation toward outcomes.
I'm sorry, anybody else? No? All right, thank you. I think we're going to hear from you later, but Sarah, you're up now.
Thank you, Chair McDonough. Commissioners, County Manager O'Connor, Deputy County Manager Hadeen, and community. First, I just want to mention that a lot of what Carissa mentioned earlier is I just want to pay tribute and thank the community for putting this in front of us back in March of 2020. And the information that we collected during our food and basic needs engagement really birthed the trusted messenger work here at the county. And so much of what are in the slide set today, we've highlighted as a part of our racial equity and community engagement response team. But what we did, right, the trusted messenger work, a part of phase 1, which really launched and started back in June of 2020. We contracted with 15 community partners and also had our media messaging work happening with 12 trusted partners. And as you see on the screen, we had our Mask Up campaign that was happening when we were asking people to mask up, and the Anika Foundation was one of our trusted messengers. And we were fortunate enough to have Javante Patton and his family of 5, he's a 5-time #1 selling Billboard recording artist, be on the front of that community-centered trusted messenger initiative. So this was an excellent opportunity to pivot from the community, the food and basic needs work, to really live up to what community had recommended to us, that we work more closely with trusted partners and community members. And so phase 2 was really from the point of November 2020 into this past winter, February of 2021. And we continued, as Sarah Maya will talk about shortly, to pivot into our trusted messenger work and to really improve what we were learning from community in those reflection sessions on what we could do better. And this messaging, I will say, as a part of the trusted messenger work here, where we partnered with 21 community members and agencies, was really focused on the push around public health messaging. And so we took heed to that right away once our community members started really talking through what do we need to communicate out to residents in Ramsey County. And then this was also the start of our Cultural Community Connectors Initiative, where we started to partner with 9 trusted community members and agencies to really provide that connection back to things like food and basic needs and workforce supports, but also make those connections and referrals back to county services and community services. And so that was an excellent opportunity to lift that up. One of the things that also came out of a lot of conversation here with the county board, I'll credit this to Commissioner Ortega, around having these community conversations. What is community in need of, right? How do we lift that up? And so we really wanted to work with, and we had the opportunity to work with 16 trusted community members and agencies who really gathered that input and knowledge on the community's perceptions of COVID-19. And this really helps, I would say, along the way, inform our county's response to COVID-19. And to this day it is, because we also worked with public health to partner on an initiative where we focused on vaccines, right, and having those community conversations. So a lot of great information to share. And this initiative happened between November of 2020 and February of 2021. So I think now I'm turning this over to our senior evaluator, Ms. Sarah Maya.
Welcome.
Thank you. Thank you, incoming Director Holly. Thank you, Chair McDonough, Commissioners, and County Manager O'Connor. It is a pleasure to be back before you again to talk about another evaluation effort that we've had underway regarding the CARES funding. As was presented to you earlier this morning, Restart is currently in the stage of round 3 of this work, and this presentation really is talking more about what we learned through round 1 and round 2. There's actually a lot of material that we could be talking about regarding those first two rounds, but this presentation is really a sampling of some of those key pieces of the evaluation work and what we've learned through this process. I'm not going to read through each of the evaluation questions that we looked at, but as we go through the presentation, you'll definitely see, how we answered each of those questions. And just to give you a high-level understanding of, how we evaluated the work, we did have our contractors or community partners submit evaluation reports where they reported both data and also more narrative descriptions of the work they did and challenges and successes that they experienced. We also did in-depth reflection sessions with our contractors as well as Ramsey County staff that were involved with these contracts. So looking at what we learned and who was served by the contractors and the strategies that they employed, there were a number of different communities targeted by both rounds of this funding, and that there really was an effort to have a diverse group of partners at the table to help with reaching out to their own communities. In round one, there were more than 100,000 Ramsey County residents that were reached through the Trusted Messenger efforts and over 500,000 through media and messaging. And then that grew even more in round two, where as we added the Cultural Community Connector work, there were more than 3,400 Ramsey County residents that were reached through that. And then as Trusted Messenger and media messaging kind of was combined in more into one effort, there was over 1.5 million reached through the work of our community partners. As far as how well did research reach those intended communities, we did find that across most of the work there really was strong representation from different communities and also in who was able to be reached through the work. One area that we did note had a little less capacity was with the Cultural Community Connectors in round two. Even as there was effort to pull in as many different types of partners as possible, there really wasn't partners within the Native American and African-born communities that either had the capacity or the interest or were able to propose a scope of work that really aligned with the purpose of that project. And so that did show back in the numbers as far as who referrals were made to, that they were very low in those areas. I'll also note that as round two was being rolled out, we did know that there were particular communities that were particularly at high risk, including the Latinx and Asian communities and youth and young adults. And so there really was a priority placed on making sure that there was coverage in those populations. Just to give you some high-level information of numbers with the round two of these efforts, this gives you a sense of what the different types of strategies the Trusted Messengers carried out and what reach they accomplished. And so as you can see, some of this was through web-based work, including social media, online materials, web-based video programming, but then there also were community engagement events, outreach activities, podcasts, and then even more traditional communication methods through radio and television. And the numbers really are quite high in many of these areas, including over 500,000 through social media, over 900,000 through television programming, over 600,000 through radio programming. But it gives you a sense of the range of different strategies that our partners were able to implement. Now, looking at the Cultural Community Connector work, and again, this was really about helping to connect individuals and families directly with resources that family may be seeking assistance around. And this included both things that might be specific to COVID-19 as far as education or testing or vaccination information, but then also what are those additional resources that people are in need of because of the pandemic overall, and with the food support and other economic assistance that either might be available through the county or through community resources. So this shows you the range of different types of needs that the partners we're able to help with connecting people, referring them to resources that were identified as a need for those families and individuals. As far as looking at the impact, we saw an impact both for the community participants, but then also for the partner organizations themselves. And so for community participants, what our partners reported back to us is that they really did see an increase in knowledge around COVID-19, use of protective behaviors, that people were more connected with services, possibly ones that they would have otherwise gone without if they weren't able to be engaged through one of these community organizations, and also with emotional support in communities, as many have really struggled around managing through the pandemic in general and dealing with losses in their community and just general stresses of what, you know, what we've all been going through that is particularly compounded for those who are already in difficult situations. For the community partners, we really saw some capacity building happen, both that they reported back that they really felt like they gained a much more increased knowledge of their own communities and understanding their community needs and really what's needed to really successfully engage with their own communities around this topic. They increased their own capacity around their own knowledge around COVID-19 prevention and the resources that are available to their communities, and that they have continued, even if they weren't maybe part of the round 2 or round 3 as partners, they certainly have continued to use that capacity and knowledge to continue supporting their communities around these areas. Many have also forged new partnerships and expanded their networks as a result of this work. So we also wanted to look at what were really the key successes or strengths of the research, trusted messenger, and cultural community connector work. And some of the key themes that we found is really that partners having the flexibility to develop strategies specific to their own communities was very important. And I believe this also came up within the food and basic needs contract work, that was something that was really important in order for these efforts to be successful. And as part of that, they were really able to cater to different subpopulations, including elders and youth, where we're really needing to understand how different groups go about seeking information is really critical in order to successfully reach them. Other key themes that really came through in how these partners talked about their work and how successful they felt they were. One was really around the use of creative and artistic and innovative strategies, that there was really anything from engaging with, you know, music artists to different performances, different concert events that really were very creative ways that these partners used. They also talked a lot about how they accessed their existing relationships and networks and how critical that was to be able to really jump right into the work as this was happening so quickly. And then finally, engaging community leaders and medical professionals, and I'll also add influencers that we don't necessarily think of as a traditional leader, but they're definitely the folks that the community will listen to or follow. For the example of the media, the masking up example that Sarah shared earlier, showing, you know, an influencer from the world of music and performance that was able to have an impact on how the community is seeing COVID-19 and how to best respond. We also looked at barriers, and that the partners reported, and some of those were related to how the county works, but then some of them were really about the conditions in which they were working out in the community and the fact that we're working in a pandemic. As was mentioned earlier, the partners really, these rounds of contract work were very short. I mean, they were a couple of months in length, and the partners really talked about how that really isn't enough time for them to really ramp up their work and feel like they're having the impact that they'd like to have. And there have been in both round 2 and 3 extensions now to recognizing that and giving some additional time. But what they really want is to be able to engage in much longer term partnerships with the county that might be, year to 2 years, where they're really able to dig into the work and to develop and sustain the relationships that they're developing throughout the community. As the scope of the contract types, because there always were a few different projects going on at once, there were times when partners were confused about what the difference was between them and where what work fell into. And so that did impact kind of how we could understand the work that they were doing and what they were reporting back to us. The partner organizations, and particularly with the cultural community connector work, where they were really trying to connect individuals and families directly to resources, they did report back barriers that they faced in helping to access county resources. And for example, may be trying to call the county on behalf of a community member where they had a signed release in place, and then being told by the worker that they could not work through this intermediary to help assist the person, and that really created a lot of barriers and other barriers around language, and that they really didn't. I think that we set up some barriers to them being able to do what we were asking them to do as part of that work. There was recognition that really a lot of this work really happens best face to face, but that's obviously very difficult to do during a pandemic. Also, distrust of government, which I know came up earlier around the data collection or identifying people, that as much as the communities trust these individuals and organizations that we contracted with, that may still not be enough to overcome the distrust of county government. And then finally, there are areas, pockets where people really were holding on to strongly holding on to misinformation about COVID-19, either about its reality or the vaccination, that it was particularly hard to change people's minds or dig into doing some education with parts of the community. We looked specifically also at how well Ramsey County was a partner with these communities, particularly through the contracting and procurement process, and that overwhelmingly, partners really had a lot of positive experiences to share back with us about being partners around these projects, and in particular really seemed to have the best experience when they felt like they had a direct point of contact that they could talk with at the county through any questions that they had. Some of the challenges that they reported back included those delays in contract execution and advance payments, that initial payment that they could get in order to start their work. And because these were already very short-term contracts, it really further tightened the time that they felt like they had to do the work. Many of these partners were also new to partnering with the county, or even with possibly being contractors, and so just the general business ideas around invoicing and reimbursement-based contracting were a challenge for some partners to understand and to really be able to provide what we needed in order to process their payments and their invoicing. Again, just general delays in payments, some with communications and technical assistance that because there were, again, different projects going on, they didn't always know when communications were coming out what applied to them or what didn't, and just really having more kind of tailored or targeted communications would have really been helpful to them. With data tracking and reporting, we've really tried to get more sophisticated each round in what we're able to collect, but as you get more sophisticated, the more challenging it is to have a system in place to collect that information in a consistent manner across partners and also for them to feel supported in that data tracking process. And so we definitely have seen challenges in that area. And really what a lot of the challenges they faced, I think really came down to what internal county capacity there is to support partners around working with us through the contracting, and that seemed to be kind of an underlying challenge for this work overall. I'm not going to go through all of these, but just to note that this has been a very, the research leadership has really been great about taking what's being learned throughout each phase and applying it to the next phase. And so there were a number of improvements that we were able to explicitly note between round 1 and 2 that were taken to really improve, to take back what we were learning from partners and also and then improve it for the next stages. Finally, looking at the recommendations, we did see both short-term and long-term recommendation opportunities for improvements. And on the short-term side, there really is a need and an interest in continuing to fund communication and education strategies with ethnically and culturally diverse communities, that this isn't something that can just be done one time and it'll have that long-term impact. It really is something that needs to happen over time. That when there are multiple projects or scopes happening at once, it's really important to make sure that the distinction between those scopes is very clear and that the activities and outcomes are well delineated between those different contract types, and really doing as much as you can to individualize and target the onboarding for each of those projects. Making sure there is internal county capacity for supporting partners with the technical assistance and having clear communications, and then really addressing the timeliness of approval of contractor materials, contract executions, and payments. And then also coordinating with other jurisdictions that are funding similar efforts. So as we know, the Department of Health has also funded Trusted Messenger efforts over the last several months, and that there was recognition that there could be potential overlap or opportunities to minimize gaps with those multiple efforts going on. On the long-term side, these are really much more broader to the county overall, that there is a need to shift to a more relational model of contracting from transactional. And that type of work really does require more resources. It requires more internal capacity to do that well. Again, as partners have repeatedly asked for, they really want this work to happen through a long-term relationship and partnership that's really focusing on sustainability of those partnerships and really the long-range impact that they can have for their communities. There is a need to include community representation in the scoping of contract work, so even deciding what is the work that needs to be done, and as well as the selection of contractors. Increasing accessibility to county services. As I mentioned before, there were some barriers faced with being able to really navigate the county system around services that were faced both by the partners and by the individuals that they were supporting. And then finally, consistent invoicing practices across the county. We did really hear from our partners that the different areas of the county do things differently, and that it's really hard for them to navigate that or to manage how to best set up their own systems to do this work with the county when it can be so different across the different parts of the county. So I'll leave it at that, and I believe we're now transitioning back to...
Actually, Krista, we're going to ask to hold off. I got
Sure.
some commissioners with questions. We'll start with Commissioner Reinhardt and then Commissioner Carter.
Thank
Yep.
you, Mr. Chair. This really is pretty amazing how quickly we adapted.
and then trying to figure out how can we improve even as you were learning what you were doing in the first place as the adaptation. And so I was struck by the when you talked about on slide 29 about the delays in contract execution and invoicing and the delays in payment. And then on slide 31, talking about the shift from a transactional to a relational model of contracting, and how that's very clear that that was a learning very early on, that that's what we needed to do. And so honestly, it's not really a question, it's just the fact that I'm really impressed with how you were able to make that transition out of absolute necessity, but you got there, and it could have very easily kind of paralyzed the system rather than transforming it. So I really appreciate the work that was done there.
Well, Ryan, real quick on this one, and Sarah, if you had a comment, and then back to Commissioner Carter.
Mr. Chair, Commissioner Reinhardt, I appreciate that, and I would add just a couple of pieces in flight still, because this is like one level of the response. There's about 4 more waves now happening. Yeah. One, you're going to see more during the budget conversations again around foundational excellence being a piece we talk about. As budget chair, we've talked about this a little bit already. Mm-hmm. This is one of the areas of foundational excellence where we need to continue to build a better foundation to do what we did, because we can't marshal the resources through the incident management team all the time to do it. And the other part to it is that the CFO and policy director have been leading work around an entire procurement learning lesson piece from this, and that's not today's focus. We're focused on recert, and the tie is there, and so we wanted to leave it here, but just to acknowledge there's more learning underway right now that'll continue to come back as well.
Thank you. Mm-hmm. Commissioner Carter?
Thank you, and just to underscore that quick transition, really is due to preparation and work that the county's been doing overall and its residents' first focus. And I do believe that we're building forward. The unfortunate opportunity, of the pandemic has escalated all of that work, and so thank you. I also just wanted to check in because as I look at the focus on transactional to relational model, moving from that transactional to relational model of work and contracting even, it suggests that we need to ensure the readiness, that we could have benefited greatly from at the start of this pandemic. And so, I just wanted to make the tie back to some of the education and engagement and outreach that you're focusing on now, but also as you look at the gaps that may have existed, for example, for Native American communities and African American communities, that readiness and preparation, is greatly enhanced when we're doing that ongoing outreach and looking to make sure that we have those partnerships that we will need for the contracting that comes forward. And I just wanted to ask if there's am I making an assumption that that's a part of what we will be doing as we look toward moving forward, or were there other recommendations or thoughts about how we make sure we have those partnerships?
Commissioner Carter, Chair Carter, I can mention, we actually did that throughout this process where we built those relationships. And I think earlier when I mentioned organizations like Division of Indian Works and our continued partnership with St. Paul Indians in Action, that took time. As Sarah Maya mentioned, many folks were already partnering with the state. And so that also posed some opportunities for us to continue the conversation, but we got there. Mm-hmm. And so I think we're very hopeful that we'll continue to grow opportunities and partnerships with community agencies that have never even thought about working with the county or even wanted to, right? And so I think that out of all of this, the silver lining is that we've built relationships. And I do want to preface that even as a part of the procurement and contracting process, we moved as quick as we could. But to community, it could feel like you're watching paint dry, right? So I do want to say that we leveraged all of the tools, all of the policies in the emergency procurement process that we could, working with Dana and her team and Alex and across our organization. But I would say that throughout this time from, I would say, from probably March of 2020 all the way to this point, we're continuing to build those invaluable relationships with community. And so my hope is that we continue that throughout our advancing racial equity work and across our county, and that not only research, but other service teams and departments can benefit from those relationships and build their own relationships, right, with these agencies and organizations and trusted members of our community. So I would say yes to everything that you mentioned. We've tried to do some of that during this time, and I think it's going to greatly benefit everyone, including
Thank
our
you,
residents.
Director Holly.
Thank you.
Clearly a part of the foundational excellence.
Thank you. Commissioner McGuire?
Thank you, Mr. Chair. Just to say what we all know to be true is how amazing this work is in the building of relationships and things, but how this is going to help us in the future, because we know that this work is I think, unique in the country, that we've done this kind of evaluation, that we've done this kind of continuous improvement. We're building and fixing the plane while, we're fixing the plane while we're building it. And this is Congress that we need these dollars from, and the state that we need these dollars from. They're going to see that we've done this kind of work, and will be more, I think, willing to work with us and willing to give these kind of dollars when they see this kind of evaluation that we've been able to do. And I'm sorry to say that we are not sorry to say, but we are a model for the country, in that people will be looking to us and how we've done this work, so that they can do it as well. And then we will be great messengers to our state and local our state and federal partners in continuing this work. So thank you for that. And that's not insignificant. It is major in the work that we need to do. So thank you for that.
Two quick observations, and we can move on to what's next. But one is, I was listening to this presentation and even some of the previous presentation. We've invested and recognized that our residents, when they come into our system, how we can help support them, and we've developed this navigator in this system. And I'm listening. We almost need this for some of our community partners, especially the really small ones that are really deep into the community. We almost need that same model as a solution. But then also listening to this, all this is, we need to do this, right? We need that foundational excellence in what we do. We need to move from transactional to relationship model, but this capacity building and supporting community organizations, I got to imagine, is the same issue for Hennepin and St. Louis and Clay County and all the communities in the state. And at what point do we start having conversations with foundations and the Minnesota Council of Nonprofits about having a statewide support group to help support organizations? Because we can't do it all on our own for these groups that are interacting with us, who may be interacting with somebody else, maybe not. But, how does it get broader than that? Because each of us building that structure to support the capacity for these individual organizations that are extremely deep, we can't do it. We can do the foundational excellence so that when we are engaging, it's a positive experience and it works well. But I think we're at a point, or I think we're at a point where we need to start talking, how do we take this statewide for this support of these community organizations? Ryan, I know you had your hand up.
It actually ties to the last two comments, Mr. Chair. The place where we need to change the narrative, late in the CARES funding, and there was a reallocation round happening toward the end of the year, right, as the state kind of scooped back its money. And I ended up on a conversation with legislators, and as they talked about it, the one thing that was a no-go was the area that we're talking about right now. And the answer for why is we don't do marketing. And I argued strenuously about the idea that this is not marketing, this is service delivery. But there is just a significant disconnect between the idea of on-the-ground impact and what was being framed at that time as marketing. And that was something that, as we go forward and we build the capacity and have the conversations with this, I just wanted to make sure we continue to talk about, because we didn't have time to really get into the depths of that on December 1st, but we do as we go forward.
Yep. And I just real quick on that, I think, having those conversations with the state and them having the same type of conversations are going to be important, but I don't see that infrastructure support coming from the state. I don't think that's going to be helpful to anybody, right? We need that to be coming from somewhere where heart and mind are equally important here. All right, Carissa, I think you're up. Sarah, thank you for the work in the report backs. Carissa, you're up for our last slide, and then
Thank you.
any final comments or questions.
So building on what we were talking about earlier, with all of our community engagement with COVID and the CARES funding, it was really reflecting back on what were we doing now and were we doing it correctly? Do we need to pivot another way? Towards the end, we started talking about longer term future and transformational change and how to keep building these relationships. And this is where we heard overwhelmingly from community that we needed to have a neutral convener. We needed to have a point person for the community and for internal systems and structures of our own to come to one place to prioritize food security. So in this, we've designated an interim food security coordinator, just myself, and we're trying to take a whole system approach to do an assessment of, I've been in the food world for years, but now COVID's changed everything. And so I'm trying to take a step back and do a whole system approach to figure out kind of a SWOT analysis. What are strengths, opportunities, weaknesses, and threats? And how can we all work together, communication? Because even in our own internal structures, WIC isn't necessarily referring to SNAP, isn't necessarily referring, so there's kind of a loop that happens, and we just want to make sure it's all aligned and working and streamlined in a lot of ways. So with this, it's going to be doing that system-wide assessment, prioritizing community engagement. And I do have to say, before, when we had over 100 people in attendance, those were relationships a lot of us have already had within the food world. There were some newcomers too, and so it's something that we want to continue to build on, is hearing from those organizations, from community, what is needed, and you'll hear more about it in the future of the work and what we identify as priorities that the community or that the county can do about, instead of trying to tell everyone else what to do. We want to be able to take our own initiatives to move forward as well. So with that, I'll turn it over to Sarah.
Thanks, Carissa. Of course, Research would like to continue to build off of community feedback to support our COVID-19 response efforts based on what was learned in these evaluations, including, improving our partnerships with community organizations, as we've mentioned a few times this morning. And then, one thing that we want to lift up too is the better tailored design and implementation based on immediate needs of the community. And I think we've done some of that even with the launching of our current vaccine initiative, really taking those lessons learned from our evaluation reports, conversations with community, and pivoting further. And so you're seeing that merging of the trusted messenger and connector initiatives brought even further together, because we know that in some ways they're one and the same. So we want to continue to do that. And then, of course, continue to explore the use of ARP, American Rescue Plan funding for COVID-19 response efforts. And I want to say we want to do that in partnership with public health. We want to do that in partnership with, many departments across our enterprise, that we continue these partnerships and continue to reduce the silos that I think for so long have existed. But COVID really forced us to immediately knock a lot of those pillars down. And I think we've done some amazing work and really centered community in our response. So thank you for having us today.
Thanks, Sarah. Questions, comments, final from commissioners?
Amazing work.
All right, I do have one, and it's more global, and it's about our evaluation team and how we use them in the county, right? Because I think, for me, I'm really starting to get an understanding, and, they've been a part of a tool we've had for a long time. But, I go back to Rush, and we brought Dana and your team in, right? That evaluation was the impetus for us to actually reconfigure Heading Home Ramsey and the continuum of care to a model that's much more responsive, right? There was a direct impact, and we were able to use that evaluation. I think, the conversations here, I don't have a good understanding of how we use it on a day-to-day basis within the county. I think about transforming systems, or the work we're doing on violence in our community, or the work we're doing with youth and juveniles in our correction system, closing Boys Totem Town. And is this stuff working? Even parts of our budget that, we're taking some things, and I just want to get a better understanding, not only how it's been used, but how do you engage your governing board in that process, so we're not only aware of it, but we're a part of you know, helping us move forward in ways that, you know, we might not have ever thought of before.
Mr. Chair, members, it's a good question. Dana and I met with some evaluation team members a couple months ago on this very topic. It's something that has stood out to me as a gap actually across the county in terms of resource since I was in the policy director role. I think, I mean, to kind of lay it in order, I mean, in the foundational excellence pitch coming in the budget, this is not the top priority right now. I think there's a few items you will see that I would argue, if not put in place first, we have a higher risk of getting to where we want to be. This does fit in the vision of the broader foundational excellence work, alongside things like audits, investigations, you know, continued work around procurement, where it all sits and what it looks like, compliance, procurement. And there's two levels to it to think about. There's the system-wide prioritization of strategic priority level, which I think rests very deeply with the governing board in that conversation. And then there's a program level of evaluation that is a tool for deputy county managers, directors, managers, all the way to frontline staff to get input into the day-to-day change in work. And what we have right now is neither one being resourced well enough to do it all, and it's in disparate spots across the org, and it creates a tension where Dana naturally says, I need more to be able to do more, and I say, but I want to do this, and like, it's a challenge. It's a spot where I actually have a note down here of, I need to talk to Alex and ARP evaluations. How do we continue to think about that with the resources we have? How do we bridge from now through the next budget cycle is a question I don't have an answer. Yeah. I just want to kind of acknowledge we're trying to work through this because it is really great as an evaluator by background to see how evaluation is helping guide us now. And it's both telling us what we're doing well and not well. And it's a tool that it's like having a compass in the woods.
Yeah, good. All right, well, we'll continue to look for updates in future budgets where we can think about how this works better for us all. Thanks to everybody. 12 o'clock on the dot. We're adjourned.
Thank you. You're good.